Today on Forbes, United Healthcare denies more claims than other insurers, angering patients and health systems. The bullet casings from the ammunition that killed United Healthcare CEO Brian Thompson reportedly had 3 words written on them, quote, deny, defend, and depose. These words allude to the strategy that some attorneys and critics have used to describe the tactics used by health insurance companies to deny making payment on claims, and the most recent available data suggests that United Healthcare, or UHC, is perhaps the country's worst offender. When it comes to denying claims, multiple reports suggest that UHC, which is the country's largest health insurer and serves some 50 million people, is an industry leader, with a rate nearly double the industry average. A recent Senate report slammed the company for denying nursing care to patients recovering from falls and strokes on its Medicare Advantage plans. And it currently faces a class action lawsuit for its use of AI algorithms to automatically refuse payment. The insurance giant's tactics have frustrated patients and healthcare providers alike. A major protest at the company's subsidiary Optum's headquarters in Minnesota in July attracted roughly 50 demonstrators, 11 of whom were arrested. Disputes with hospital systems over UHC's claim denials have led to some deciding not to accept its insurance at all. Insurance insights firm Value Penguin told Forbes that gauging an exact number of claim denials is tricky, as there's no central repository of this data. But according to one of the firm's reports on insurance claim denial rates, UHC has the highest instance of denials out of all major providers, refusing an estimated 1/3 of claims submitted. The insurer did not respond to a comment request. United Healthcare also has the largest market share of health insurance policies, with roughly $215 billion in revenue. Value Penguin said that based on current insurance plan costs, UHC offers the most expensive premiums in the nation compared to other providers. For example, a middle-tier plan with UHC would cost a 40-year-old person $631 per month, whereas the national average would amount to an estimated $621 per month. The shooting has reignited a national conversation about America's for-profit healthcare sector and many people's inability to afford treatments and medication. Healthcare.gov issuers denied a total of 17% of claims in 2021, with some issuers' denial rates reaching 49%, according to a 2023 report by health researcher KFF. In a 2023 survey of consumers' experience with their health coverage, KFF found that nearly half of adults who had insurance problems were unable to satisfactorily resolve them, with 15% saying they experienced a decline in their health and 28% saying they paid more than they expected. United Healthcare announced a new policy, effective December 1st, by which it may deny charges for inpatient or outpatient services that it considers, quote, routine, which would give the insurer more opportunity to issue denials around specific line items, according to healthcare attorneys at Davis Wright Tremaine. The UHC CEO was shot and killed as he was on his way to a Manhattan investor meeting for parent company United Health Group around 6:45 a.m. last Wednesday. In the hours after, anger and frustration over insurance denials and medical costs bubbled up online and in conversations. One angry poster wrote on X, formerly Twitter, quote, when you shoot one man in the street, it's murder. When you kill thousands by taking away their ability to get treatment, you're an entrepreneur. Thompson's wife, Paulette, told NBC News last Wednesday that she was aware he had received some threats. She said, quote, basically, I don't know, a lack of coverage? I don't know the details. I just know that he said that there were some people that had been threatening him. At the Forbes Healthcare Summit in New York last week, attendee Michael Patton, founder and president of Excel Health Plans, said his initial reaction was that the shooting may have been related to someone whose claim had been denied, given the anger such an experience can cause. As of this recording, police are still searching for the suspect, and his motivation remains a matter of conjecture.
Hi, y'all. So we do have much more that's going on, the twists of events when it comes with, the crazy tragedy in regards to United Healthcare CEO, Mr. Brian Thompson. And it turns out that the fact that we actually know now and basically giving all the replies you see on social media, actually just actually being nonchalant, basically about his unaliving. Basically, we found out that a homeboy here was not a saint during his tenure at United Healthcare. And also, I just want to take a bit of a quick note that United Healthcare is part of United Health Group. So basically, it's under the United Health Group banner. I just want to try and make that stuff literally very, very, very clear. But as I stated before in my podcast, definitely early on, in regards with, the grimy nature of, the complex, cutthroat nature of the healthcare industry, I basically stated to like a lot of people, especially in myself, like the member has full on 100% responsibility when it comes with actually dealing with their respective insurances. Okay. And what we found out, given the situation with United Healthcare, basically they are actually having like a bit of a fits, have a lot of complaints that have been going on by its members. They've been literally having to fight off literally the delay of denials. And basically what United Healthcare was mainly doing is actually trying to deny as much of those requests by those members for as long as they can, just so they can try to make an extra profit out of them, as well as the practitioners that are actually part of those networks. And not only that, they want to try and delay the payments of those practitioners as well as their medical, dental, or even physical therapy practices. So they can try and make a boatload of money on the practitioners as well as the members. So it's very an unfortunate sin and a shame in regards to that. So I just want to try and actually just lay those things out there. And I found out in the news that United Healthcare is also being sued, or actually being basically been sued by the Department of Justice for insider trading. Yeah.
New details are surfacing tonight about a lawsuit against Thompson and other United Health Group executives, accusing them of insider trading. Jessica Hart has more on the lawsuit and what it could mean for the overall investigation.
For the past couple of years, United Health has been at the center of controversy. United Health Group announced 2 years ago it was acquiring Change, a healthcare technology company, which piqued the interest of the Department of Justice. The DOJ tried to stop it by suing United Health. They alleged the acquisition would violate antitrust laws, but a judge sided with United Health. Jump to February of this year, United Health is dealing with the fallout of a cyber attack against Change. Around the same time, the public learned the DOJ was once again looking into United Health, leading to lawsuits. The healthcare company, along with some of its top executives, are being sued over allegations of insider trading. One of those executives is Brian Thompson, the CEO of United Healthcare. He was shot and killed in New York City Wednesday morning. Thompson and United Health's board chair Stephen Hemsley are being accused of selling some of their shares of United Health stock, knowing the company was being investigated, information investors and the public didn't have. According to the lawsuits, the plaintiffs are accusing Thompson of selling over $15 million of his personal shares between October 2023 and February 2024, when the DOJ investigation surfaced. Within that time frame, the lawsuits state Hemsley sold over $102 million of his personal shares.
The first class action lawsuit was initially filed in May with the City of Hollywood Firefighters Pension Fund. On Wednesday, a judge signed an order giving United Health, Hemsley, and Thompson until March 1st of next year to respond to the amended complaint.
So again, I don't celebrate, I don't congratulate Brian's death, but don't make it seem I'm literally too like all sad for this guy at all and all these things. Yes, you do mourn for the family for sure, but like many of them, I feel also indifferent in regards to situations as well after actually what came out. And the crazy part about this whole ordeal is, yes, the politicians should actually be able to actually take a stand in front of this, and they should, as I stated in the last podcast, in regards to that. But again, unfortunately, they have a lot of these big time healthcare companies have their own lobbyists that they actually petition down to Capitol Hill. to actually petition like either the Senate or the representatives to actually try and push for those. They actually dictate which politicians to vote for. They put actually money up in the books of these politicians to try and push their narrative and push certain laws that are mainly going to benefit them. And that's really an unfortunate situation. That's mainly going on. That's why you see many of these lobbyists, many of these CEOs actually really get punished because they got the deep pockets. You see a lot of these politicians actually just getting hooked on the money rather than actually caring for the community. It's really like a whole chaotic show that's gone down, mainly behind the scenes, which is a sin and a shame. Now, what also makes this whole situation worse, given from my position as an office coordinator that works in a medical practice, okay, as crazy and complex as it is, what makes my job basically the most stressful is when you got to be dealing with like payments and insurance infighting and insurance mainly denying claims, excuse me, insurance delaying payments towards the doctor's office, towards the doctor himself. Also actually dealing with like a bunch of curveballs as well, not even being fully aware of like certain networks or insurances within a certain amount of time. That causes like a lot of heat. Certain ordeals actually getting patients ticked off and all these other things that can cause a lot of infighting between the office as well as the patients, which is a clear-cut unfortunate thing. So this is why I mainly stress to y'all, and for those of you those members actually come by whenever you want to visit like a medical office, doctor's office, or anything else, always, always, always be proactive and be responsible with your insurance and know which doctors are in network as well as which doctors are out of network. And I've actually gave you guys a bunch of good I already give a good like initial beginning details on that podcast in the episode. So for more information, you could definitely actually look into that for sure. But I also want to actually try and go a bit further on how the whole in-network process with doctors work. So basically, if a doctor actually just wants to apply to some set insurance company and wants to actually try and get involved or link up and get paid by some set insurance company, first they would actually have to apply online or through mail to that said insurance company, depending on like what their rules and regulations are. Then they would have to actually deal with a vetting process, whether or not the insurance accepts it or not. That's a whole different story. That process could take around weeks to months. Then they would have to actually try and give them an offer. Should the insurance accept them, they would actually try and give them an offer to see like what rates they'll give the payout and what rates they'll accept. And they have a contract from the doctor, or whether it's a doctor, dentist, physicians, PT, someone dealing with physical therapy, they have contracts to uphold in regards to insurance just to maintain themselves in good standing so that they'll be able to actually get paid by said insurance. And that process may take a while. And yes, they're going to have to actually acquire the medical licenses, flu shots, tax ID number, MPI number within the state. A lot of variable factors that mainly come about when dealing with the in-network process, which is a craziness of how all this finance and stuff when it comes with the healthcare industry mainly work, and as well as the pharmacy too. So it's a lot of complexities when they deal with that. So not only do they shorthand members, they can also shorthand practitioners in their practices. They can shorthand doctors, they can shorthand dentists, they can shorthand physical therapists as well. When it comes to these ordeals, they can shorthand hospitals, they can shorthand pharmacies, given certain natures on like what they're going to pay and what they're not going to pay. Because again, a lot of these insurances, I'm not saying all, because there are some that actually are fair, but some to a lot are in it to actually make as much profit as possible, and they will do a lot of shortchangings, and they'll do like a lot of denials and do a lot of delaying as much as possible just so they can try and make maximum profit, which is again saying a shame. And I can resonate with why a lot of people that are up in the middle class or lower are mainly feeling in regards to this whole topic and in regards to this whole outlook. So which is why I mainly stress to members, okay? Insurance members, you are 100% responsible. for what you do with your insurance and the co-pays and the co-insurance is given, as well as trying to figure out and research which doctors are in those networks. And if that's a doctor that you mainly had up in the past, you have to double check and make sure that that doctor is definitely in network with that particular insurance by speaking with that insurance provider. Now, there could be changes where like a doctor could be out of network for whatever reason due to conflicts, definitely unbeknownst to your knowledge, or in a couple months, unbeknownst on what you see, which definitely could happen. And there could be things where things mainly go through and all of a sudden you actually just feel betrayed or you feel backstabbed or actually got curveball just because some insurance actually just mainly just pulled out of that particular network unbeknownst to their knowledge. Now, if they actually pulled out of that network or actually just cut ties, normally what the insurance would do is they would definitely send a letter over the mail, letting that member know that that member is no longer in network. They would definitely let you guys definitely know in advance when it goes to these things. Or sometimes they may not actually do these things. Sometimes they may not forget you and let you know, and maybe may take a staff member to actually just let the folks know, and they may be in the process of actually disconnecting from said insurance altogether due to the fact of like what's going on with financial constraints or financial conflicts. They may cut ties off with that particular insurance due to the fact as well, which is also very, very unfortunate. This is why you have to do your best to be as proactive as you can. And yes, my role is also to make sure I have to be the cleanup man, just to make sure everything is thoroughly double checked as much as possible. But even we have our flaws from here and then. Even we have our shortcomings every now and then when it comes to these types of things, which unfortunately does happen. But again, that all falls definitely on you and your responsibility. So make sure if things go south and, you have a visit or anything like that, just make sure in the case that something like this happens, make sure you try and find a way to actually finance those visits and make sure you do your best to actually try and get a plan to actually get that stuff paid out as quickly as possible. Because again, practices need money for themselves to survive and continue to see patients as well. So we need that money to definitely cover up those debts. And sometimes they may be going to aggressive and actually trying to store credit card information as a protective mechanism, just in case they go through some debt, they actually go charge the card as well as a protective mechanism. So there's a lot of stuff that mainly goes on behind the scenes with certain practices that a lot of you guys mainly know nothing about, which I'm actually trying to actually give you some game on right now. So again, be proactive when it comes to these types of situations. And if you actually do get caught up, but if you actually do want to try and deal with war, but if you have people and practices actually trying to come out and mainly remind you of like charges to pay every other day now and then, understand that they're doing their job. They're not trying to out here to actually be demeaning for you, actually to play catcher. They have a job to do and they're trying to make sure that their debts are owed as well. You know what I'm saying? Which is a sin and a shame to actually go about it. But again, if you guys do want to go to war, if you want to try and make our day horrible and make our day bad, you could give us one as much as you want. But if you actually do find us, these do unpaid bills or do some more deals that's out of network over these things, and you try and fight it with insurance, the insurance is going to side with the provider the majority of the time because that responsibility mainly falls on you at the end of the day. Now, there may be some other cases when it comes to certain insurances, and the practice may have to deal with the refunds, and a lot of billing complexities come by whenever we have to try and deal with the process again, a refund, and the office coordinator definitely does feel helpless throughout these times, and it's like definitely a stressful process when you literally have like your head cut off, and you're definitely helpless at that point. Which is why I say to you guys, please, 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 okay. Please be proactive when it comes with your insurance. Please do research on certain insurances, on which stocks are in network and what their mindsets are, and do the research on how often they deny those claims, just to make sure that you don't end up being on like the wrong end of the stick. All right. It's all about making sure you actually get the best possible care and also get like the best possible benefits. Definitely not just for you, but also for your family in regards to this. And yes, our jobs as office managers and office coordinators, we want to try and do our best to make sure the patient has the best quality care possible. But again, due to the complexities of the healthcare industry, some days you feel helpless due to like certain processes when it comes to insurance and finances. And also understand that we do also need money just to survive and make sure we continue practicing to serve those patients that are desperately in need. All right. So again, definitely a quick update in regards to this. I know this is some extremely important stuff. And once again, these types of things, I think the whole ordeal is actually moving around because we got lights actually being mainly turned off here, but we got everything back. And let me try to backtrack so I don't get anyone else up in frame because I'm up in the gym. So we want to try and respect their privacy up in here. So once again, definitely make sure you actually stay proactive when it comes to these types of things, literally down to BT, myself included as well, in regards to that. It's a sin and a shame, politicians, if they out here actually embedded in all this stuff to try and get all this money, actually trying to pass laws that get you jammed up and actually trying to benefit insurance companies. Though I think in the next election cycle, definitely vote these guys out, and because it's, again, they're not serving in your interests. They're not trying to actually give you like the best potential care. These guys need to be voted out, and then the next election cycle mainly comes about. You need to find somebody that's going to work in the best of you and not going to deceive you like that. You know what I mean? It's this rabbit hole is literally so deep with this whole health insurance process, and this is literally insane. That's literally unraveling right in front of our faces. And the worst part about it is you got all these other CEOs that are actually trying to push for security and actually trying to sell more money for security, but how they able to get more of that funding? By unfortunately also raising the premiums of those members just to make sure that stuff actually gets happens as well. So it's a crazy situation. It's unfortunately a depressing situation. But again, at least I'm just here to give you an update in regards to the whole chaos that's been going on up in United Healthcare. Chris Paul from Nerd Chronicles has signed out. Deuces.